Hello everyone, I am L.Mansurova, Associate Professor of Department of Pharmaceutical Technology and Management. I welcome you and would like to present to your attention a last lecture in the course of Pharmaceutical Economics for third-year students of Faculty of Pharmacy. Lecture number 7 is devoted to study of pharmacoeconomy, principles and indicators of pharmacoeconomic evaluations. Let me introduce you to short plan of our lecture. First, we will study differences between economics and health economics and learn concept of essential medicines. After, we will study definition of pharmacoeconomy, steps in pharmacoeconomic analysis, types and principles of evaluations. After, we will study healthcare costs and outcomes and discuss advantages and disadvantages of each method of pharmacoeconomic analysis. Let's start. Medicines have a great potential to improve health outcomes and healthcare system generally. But last years, healthcare system clashed with some problems. Many changes have recently taken place in healthcare. Introduction of new drugs, new technologies, new methods of diagnostic and treatment have been among these changes. The increase in the number of new drugs combined with the increase in costs provide a great challenge for all healthcare systems. Healthcare programs across the world are faced with the challenge of making evidence-based decisions on medicine selection to ensure the value of money. Value for money is not the same as affordability. Value for money relates to the outcome relative to money that are spent on pharmaceutical product, medical and pharmaceutical services. And medical care and pharmaceutical care need to be analyzed not only from position of medicine but also from position of economics. That's what is economics. From our previous lectures, you know that economics is a study of how society allocate their scarce resources to satisfy the demands of citizens. Health economics focuses on how these scarce resources are allocated to produce health and provide medical services. Pharmaceutical economics, derived from health economics, is one part of health economics and focuses on how resources are allocated to provide pharmaceutical care. That's the main problem of economics is allocation of scarce resources. But true cost of a resource should be analyzed, and a method for judging these costs need to evaluate and determine opportunity cost. Opportunity cost can be defined as the best alternative that was given up by taking another course of action or another medicines. In other words, opportunity cost is the value for the best foregone option and is the value for selection of best option for healthcare costs. Which factors impact on the structure of healthcare costs within the country? First, of course, population demographics, factors such as age, gender, social characteristics, number of employed people, unemployed people, children, elderly population. Then population affordability also is factor of consideration. Characteristics of standards of living and quality of life, and a high level of these standards need more costs and more resources. Organization of healthcare system within the country in globe scale and globally and regionally. Medical technology development and availability of appropriate information. Healthcare service costs, pricing policy for medicines, existence of some social programs for support poor population or special groups of population, medical insurance coverage. Concept of essential medicines, which was proposed by World Health Organization at the end of 1970s, helped to solve some problems. Essential medicines are intended to be available within all kind of health care system organizations at all times in adequate amounts appropriate to population, to patients, to hospitals and other medical prophylactic institutions in the appropriate dosage forms with assured quality and adequate supporting information, and at a price the individual or community can afford. Selection of essential medicines should be based on the evaluation of not only clinical outcomes but also cost and cost effectiveness. And value for money, which is considered as one of important part of selection of these medicines, relates to the outcome relative to the money that you spend on a product or service. A list of essential medicines have been updated each second year, and it consists of core list and complementary list. Core list list of minimum medicine needs for a basic healthcare system that are based on efficacy, safety, and affordability. A complementary list consists of essential medicines for priority disease for which specialized diagnostic and monitoring facilities needed, and complementary list also includes medicines with high prices, costly medicines, and their high cost need to be proved for their effectiveness. That selection of essential medicines should be based on pharmacoeconomic analysis. What is pharmacoeconomics? The word derived from two Greek words, pharmakon, drug or medicine, and oikonomia, management of household. As a discipline, as a direction of science, pharmacoeconomy identifies, measures, and compares the costs and consequences of pharmaceutical products and services. The purposes of pharmacoeconomic analysis, provision, description, and analysis of the costs of drug therapy to healthcare system, to society, determine whether the added benefit of a pharmaceutical product or service or intervention is worth this added high cost, and evaluate and compare the total costs and outcomes of pharmaceutical treatments, services, and interventions. Pharmacoeconomical analysis could be considered from position of patient, hospital, provider, and society. For a patient, this information is necessary because in case that patient afford healthcare expenses by himself or herself, he needs to know that cost of medicine or intervention was proved and justified by evidence-based medicine. From other side, hospital and healthcare providers, during preparation of some formularies or lists for provision of hospital by medicines and medical products, need such information for make better choice and make wise decisions. Provider of healthcare, usually insurance companies, they are interested party in these pharmacoeconomic studies. And you know that in Western countries, insurance companies sponsor these studies because they need proved information about cost effectiveness of medicines and evaluate true value of pharmaceuticals. Society, during realization of some social programs, supporting of poor population, or provision of some groups of patients with free medication, they also need organized selection of medicines according pharmacoeconomic consideration. That's pharmacoeconomic evaluation first help to reduce monetary burden on the consumers and generally on society for the effective management of healthcare system. It helped to organize efficient use of limited resources for maximization of healthcare benefit, and help to make decisions about drug therapies and interventions. In pharmacoeconomic evaluation, costs and outcomes are considered and compared, and at least two options are compared. For example, two or more pharmaceutical products could be compared by this way, or pharmaceutical services, organization of pharmaceutical services, or some method, medical method or intervention could be compared and considered. And one of the options in the comparison can be a without option, comparing some method of treatment to doing nothing, or true medicine with placebo. Sorry. There are four main methods of pharmacoeconomic analysis, but despite of method, the sequence of steps for pharmacoeconomic analysis are same. On first stage, problem should be defined, and problem about selection of essential medicines or other problems. After determining the study's perspective and how it will be applied into practice within country, within region, or globally. On third step, alternatives and outcomes should be determined, and resources of study need to be identified. You know that this process is quite a costly process, and number of patients, number of hospitals and other healthcare institutions need to be determined and identified. After establishing the probabilities of the outcomes and placing a monetary value or other units to evaluation of outcomes and costs. After that, appropriate method of pharmacoeconomic analysis should be selected. Only on this stage it is selected and analysis is conducted. After realization of pharmacoeconomic analysis, advanced methods such as decision analysis need to be applied. After sensitivity analysis is performing, and at the end results are presented with any limitations of the study. Pharmacoeconomic analysis may be conducted as an economic assessment incorporated into clinical trials, and it is difficult to justify a pharmacoeconomical trial as a separate independent trial, primarily due to its high cost. And the evaluation may be done at any time during clinical trials, especially in phase 2 or 3, and in frame of realization of health technology assessment for modern direction of analysis of healthcare system. The reasons for conducting includes following. First, pricing of a new drug. You know that pharmacoeconomic analysis, if it is provided during clinical trials, help to determine true price of new medicine and justify its high cost. Repricing of an old drug. When generics appeared on the market, producers of brand medicines need to update their pricing policy and reprice their medicines. Convincing a drug formulary, selection of essential medicines is also reason for conducting these trials. Generation of data for promotional material. You know that medical agents which deal with promotion of new drugs as representatives of pharmaceutical companies need to present information about benefits of their medicines, and if this information is based on pharmacoeconomic analysis, it creates some respect and trust from healthcare providers to this company and to this medicine. And sometimes mandatory legislative requirement for drug licensing during application procedure need conducting of pharmacoeconomical trial. Principle of pharmacoeconomic analysis base that every medical product or any intervention or any method has some outcome, and these outcomes could be positive as benefit and negative as any adverse effects. In pharmacoeconomic analysis, not only outcomes are analyzed and compared, but also cost of acquiring treatment or medicine or intervention is measured against the outcome. We can describe the process of pharmacoeconomic analysis as it is shown on this scheme. We have some input, some resources for acquisition of this medicine, costs related to medical treatment or intervention, some process during which medicines is used, administered, medical treatment has some result, and output or outcome. Outcome or output need to be considered relative to input. And usually input in any kind of for basic pharmacoeconomic analysis is considered as cost and usually expressed in monetary units. Principle of assessment of output or outcomes are vary and differ from one method of pharmacoeconomic analysis to another. On first stage, healthcare costs need to be defined. There are 4 types of healthcare costs: direct medical, direct non-medical, indirect costs, and intangible costs. Direct medical costs include medicines and acquisition of medicines or devices or some medical products, cost of diagnostics, visits of physician, hospitalizations, emergency care, and like this. Direct non-medical costs, they also associated with patient treatment, but they are not medical in nature. For example, food provision or other provision during inpatient stay at hospital, travel costs of patient to obtain treatment or make some administration of drug, child care services, and like this. Indirect costs, associated to loss of productivity because of illness for patient and sometimes for his relatives, family members, days loss, work days loss because of illness, family caregiver time, productivity loss. And the last type of costs are intangible costs, which are very difficult to economically evaluate. Cost of suffering due to illness, pain, fatigue, distress, anxiety, and these intangible costs are very difficult to be presented in any monetary units or in any other units. The defined daily dose is a method for calculation of and assessment of direct medical costs, and it's defined as the assumed average maintenance dose per day for a drug used for main indication in adults, and its monthly need could be calculated by this way. I said previously that in a pharmacoeconomic analysis, costs should be analyzed relative to outcomes, and outcomes should be analyzed relative to costs. For evaluation of costs, we use EHO model, which includes economic outcomes, clinical outcomes, and humanistic outcomes. Some of them we can calculate and assess in monetary terms easily. Some of them are difficult evaluated. Health outcomes could be expressed in natural units such as number of cases cured or number of deaths or number of symptom-free days or strokes prevented, peptic ulcers which healed. And some indicators of health outcomes present in form of health-related quality of life, which is difficult to express in quantitative form, but qualitative could be assessed. Health-related quality of life could be exist in form of four components: physical, therapy, psychological, and social. Physical component is about how medicine or treatment affect on general health status of patient or overall health. Therapy component, its impact of therapy on status of patient, satisfaction with care. Psychological component, how medicine or method of intervention affect on emotional and interpersonal functioning. And the last component, social component, impact on patient's social functioning, how easy he integrate into society. Some indicators which use for assessment of outcomes called quality adjusted life years, GALI method, which measure the usefulness or utility of a health state and the quality of life lived in the health state. This indicator of outcome help to assess outcomes of treatment or medicine from position of quality of life. GALIs integrate mortality, level of death, and morbidity, level of illness, into a single measure to express health status in terms of equivalence of years of life. It's expressed in form of years. Disability adjusted life years is opposite method, which based on concept of potential years of life lost due to premature death. The DALI is a measure of disease burden and includes years of healthy life lost to states of less than full health or disability. For one method of pharmacoeconomic analysis, for cost utility analysis, use method of this indicator of quality adjusted life years. We will talk about it later. There are four types of pharmacoeconomic analysis. Cost minimization analysis, when outcomes of two alternatives to method of treatment or two medicines are identical, and it is necessary only to compare the costs. It's the simplest method of pharmacoeconomic analysis. Second, very popular method, cost effectiveness analysis, where outcomes are presented in natural health units such as life years saved, blood pressure parameters, and blood glucose, or number of strokes prevented, or ulcer healed, or days without symptoms. And in this method of analysis, only one outcome should be chosen for comparison, only one outcome. Cost utility analysis is similar to cost effectiveness analysis. It uses also natural units and quality adjusted life years unit. And the last method, the most complicated method, cost benefit analysis, which converts all outcomes to monetary units and can combine multiple outcomes in one analysis. That's you need to comprehend that costs in all these four types of analysis are measured in monetary terms, in form of money, in monetary terms, units, but assessment of outcomes is vary. Method of assessment, principles of assessment are vary. And in cost minimization analysis, outcomes which produced and compared, they assumed to be equal, and they measured in natural units. In cost effectiveness analysis, outcomes are compared against the difference in costs, and they measure in natural units. In cost utility analysis, outcomes are expressed in form of quality of life, quality adjusted life years or disability years, and in cost benefit analysis, or all outcomes are expressed in monetary units. Let's start from first the simplest analysis, cost minimization. This method, as I said previously, compare products that have been shown to be equivalent in therapeutic effect. That's outcomes of two methods or two drugs are same or similar. And only cost need to be compared, and least cost alternative is chosen. By this method, usually are compared brand and generic. You know that brand cost much more than generic, or different antibiotic therapies, different route of administration, such as oral method of administration and parenteral. And it's a very important factor, administration of the same medicine in different settings, outpatient versus inpatient. You know that placement of patient in hospital is much more costly process, and it needs more resources. That's why it is very important factor of consideration. Calculation is carried out by this formula, where you see difference between direct costs of treatment, method 1 and method 2. Method could be method of intervention or some medicine, or calculation both of direct costs and indirect costs. On this table, I presented comparison between two drugs. Drug A, cost less, acquisition cost, is price of medicine than drug B. Administration of drug A, maybe it needs some injection, and for this patient need to travel to the hospital. It costs 75, and for drug B, maybe it is oral medicine and could be used by patient at home and cost 0. Monitoring of results of treatment for drug B cost less than for drug A. Adverse effect of drug A is also higher than drug B, maybe days which patient need to stay at home, work days lost. And you see that despite of primary cost of drug A is less than drug B, total cost of drug A is more than drug B. And in case that outcomes are same, of course best chosen alternative is drug B. The advantage of this method is that it is very simple method, but disadvantage includes the fact that it cannot be employed when outcomes of the products or methods are not equivalent to each other. Second, most popular method, cost effectiveness analysis, when treatment alternatives which use for same medical condition measured in the same natural health units. Outcomes are assessed in form of natural health units. Costs are expressed in monetary terms. Which natural units are used for this method of analysis? Cases cured, hospitalization prevented, life saved, symptom-free days, blood glucose level or blood pressure, and other. They presented in form of ratio, and choice is that of lower ratio. This method cannot be used to compare treatments or interventions used for different conditions, different disease with different outcomes. Method of calculation, formula for calculation. You see direct costs, indirect costs divided to effectiveness, outcome in natural units, or as incremental cost effectiveness ratio when it is calculated like this: cost of first medicine or method minus cost 2 divided to effectiveness of method 1 and 2. How does it work? Let's analyze this table. Again, we have two medicines, or it could be different methods or interventions. Acquisition cost, drug B cost higher. Administration for B 0, monitoring 0, adverse effect like you see, and subtotal cost of drug A is higher than subtotal cost of drug B. But when we compare outputs, we see that extra years of life when drug A is used is higher than when used drug B. And ratio shows that best alternative chosen is drug A. Disadvantage of this method is the subjectivity that surrounds conception of incremental cost effectiveness ratio, because this parameter does not consider quality of life, only years of life. Cost utility analysis, next method of analysis, is a subset of cost effectiveness analysis, and here outcome is measured using quality adjusted life years. A unique utility outcome measure which takes morbidity, as I said, level of death, and mortality, level of illness into consideration, and also quality of life is considered. The length of life saved is measured against the patient's quality of life. As I said previously, maybe patient live longer, but his or her quality of life is poor. Costs are measured in monetary terms, outcomes in quality adjusted life years. Least cost, of course, preferred. By this method, usually evaluated some arthritis treatment or some serious chronic disease treatment, or chemotherapy which increase survival but decrease patient well-being. Formula for calculation like this: direct costs plus indirect costs divided to utility in quality adjusted life years. Results of comparison. You see that again drug A costs less than drug B, but subtotal cost of drug A is much higher than drug B. When we assess utilities in GALI, quality of life index in drug B is higher than in using of drug A. and quality adjusted life years higher for drug A than for B. It means that patient well-being, patient quality of life when using the drug B is better. And as a result, ratio shows that drug B is better alternative chosen. Advantage of cost utility analysis is that in comparison to cost effectiveness analysis, that incremental cost effectiveness ratio is calculated for 2 or more medicines for the same medical condition. But this method could be implemented for comparison between several medical conditions. And other advantage is that outcome measure does not need to be expressed in monetary unit and expressed in form of quality adjusted life year. Disadvantage of this method is that quality adjusted life years can be difficult concept to comprehend and is not used frequently by clinicians and decision makers, because for clinicians, for healthcare providers, years of life saved is more important than quality of life. And lost productivity may not be taken into consideration as part of morbidity for an assessment of quality adjusted life years, and might limit the cost utility analysis. The last method is cost benefit analysis, most comprehensive and most complicated method of pharmacoeconomic analysis. And this method aims to calculate the economic benefit of an intervention. In this method, both the inputs, costs, and outputs, outcomes, are measured in monetary units. You remember that in other methods of pharmacoeconomic analysis, for calculation of costs we used monetary units, monetary terms, but for calculation of outcomes we used other method, natural meters or utility units such as quality adjusted life years. Results expressed in as ratio benefit divided to cost, or net benefit or net cost. This method helps policymakers answer two important questions. Do the benefits of a program or intervention outweigh the costs? And which program will provide the greatest benefit? Economic consideration in this method play most important role. Benefits can be viewed as cost savings or costs avoided. Here you see comparison between these two medicines. Again, same subtotal cost of drug A is higher than of drug B, despite of that drug A cost less than drug B. Benefits expressed days at work are same for two medicines. Extra months of life for drug B is higher parameter. Subtotal drug B outcomes of benefits of drug B higher than of drug A. If we see the ratio benefits divided to costs, benefits divided to cost, we see that ratio shows that drug B is a better alternative, and net benefit of drug B is much higher than net benefit of drug A. In this case, we will choose drug B. Advantage of this method is that many different outcomes can be compared, because benefits are measured in monetary units. You just need to transfer these outcomes into monetary units. if conducted correctly, it is a very comprehensive analysis, but also very complicated. And if interventions for different disease states are compared, for example, asthma clinic compared for a diabetes clinic, the intervention with the highest benefit to cost ratio would mostly likely to be selected for maximized resources. This method usually used on level of government for organization of provision of some realization of carrying out of some social programs. Disadvantage because it is difficult to attach monetary value to some types of outcomes, for example, life saved, making this analysis complex to conduct, and is regarded as the most comprehensive pharmacoeconomic analysis, but also the most difficult to apply. There are other types of pharmacoeconomic evaluations which are not considered as full pharmacoeconomic analysis, but some forms of evaluations. Cost analysis or partial economic analysis. In this analysis, only costs are compared and measured, not outcomes. Clinical outcome study, this opposite to cost analysis. In this study, only clinical outcome analyzed and only health outcomes are measured, not costs. These methods are usually used by healthcare providers, by doctors. And cost and clinical analysis. In this analysis, a list of costs is provided for a list of health outcomes. And in this method, all outcomes are listed with the corresponding total cost. This method differs from cost effectiveness analysis, where a single outcome is studied. For this method, several outcomes are listed and could be compared. I would like to say thank you for your attention. It was the last lecture in this course, and I wish you all the best. I hope that soon, very soon, I could see you in classrooms of our university. You are every time welcome. Don't forget that if you have any questions regarding the material of lecture, don't hesitate to contact me by mail. Bye.